হ্যালো এভরিওয়ান, ওয়েলকাম টু বেঙ্গলি নার্সিং লার্নার। আজকে তোমাদের সাথে আমি JEPBN 2024 অ্যান্সার কি নিয়ে আলোচনা করব। যদিও WBJE থেকে অ্যান্সার কি বেরোবে, আমি তাও নিজের মতো একটা অ্যান্সার কি রেডি করেছি, যেগুলো তোমাদের সাথে শেয়ার করলাম। তাহলে চলো দেরি না করে শুরু করা যাক। প্রথম থেকে শুরু করছি। আমি শুধুমাত্র অ্যান্সারগুলো বলে দিচ্ছি আর কোয়েশ্চেনটা পড়ে, কারণ না হলে ভিডিওটা অনেক বড় হবে। During normal breathing, the amount of the air that moves into the lungs and come out is called tidal volume. Option D. The end product in the process of blood coagulation is option A, fibrin. Renin is a hormone secreted by option B, kidney. All of the following hormones are secreted by anterior pituitary except option B, oxytocin. Broca's area is located in which lobe? Option B, frontal. CSF is secreted by option C, choroid plexus. Hematocrit value is the ratio of option C, RBC to plasma. Which of the following hormone helps in secretion of HCl from stomach? Option A, gastrin. 9 নম্বরে যেটা আছে, which part of the human brain is primarily responsible for regulating heart rate and blood pressure and respiration? সঠিক অ্যান্সার অপশন সি, brainstem. Which of the following term describe the body's ability to maintain the normal state? Option D, hemostasis. In trias, yellow color indicate option B, argent. The nurse asks the client to read the Snellen chart. Which of the nerve function is tested? Option option A, optic. 13 নম্বরে আছে, which of the following is a plasma volume expander? এটা হবে hemaceli. Final stage of grief is acceptance. 15, solution of the higher osmotic pressure that pulls fluid from the cell is hypertonic. Crackling sound bilaterally at the base of lung is referred to as rales. Option C. এবার 17তে আছে, পজিটিভ ব্যাবিনস্কি সাইন ইজ অ্যাবনর্মাল ফর অ্যাডাল্টস। 18, what information does anecdotal record contain? Option A, record of some observation about person. What can be assessed by Romberg test? Option C, balance of a person. Client has positive Trossel sign. Which electrolyte imbalance can be expected? এখানে option B, calcium. Goodell sign indicated softening of cervix. Fundus of the pregnant uterus is palpable at 40 weeks of gestation at the level of 32 weeks. Which type of pregnancy sign is in quickening? এটা হলো presumptive sign. Option B. The single most hormone for maintenance of effective and continuous lactation is prolactin. 25 আছে, the dose of anti-D immunoglobulin for Rh negative mother after the birth of the baby is 300 mcg. Umbilical cord is attached to the edge of the placenta is called battledore placenta. Option C. Carcinoma cervix in stage 1, এটা হবে option A, carcinoma is strictly confined to cervix. Narrowest part of the fallopian tube is interstitial portion. Option A. Type of placenta previa in which placenta completely covers the intestinal os is known as central placenta previa. Option C. The immunoglobulin that crosses the placenta barrier is IgG. Option B. The family which one sets up after marriage is termed as family of procreation. Option D. Next, 32, practices that have been repeated by a multitude of generation practice is referred as custom. In India, the most rigid system stratification is caste. Option B. Social change referred to option B, change in the value of the society. The scientific study of human population is termed as demography. Option B. A nurse would advise the patient to avoid salt substitute and foods such as banana, tomato, orange juice for the following disorder. Option A, hyperkalemia. 37. Absence of the following clotting factor leads to hemophilia A. Hemophilia A হচ্ছে factor 8 এর অভাবে. Option B. A client weight 36 kg is admitted in emergency department with 40% burn. Use Parkland formula. Client's 24 hours IV fluid replacement should be option C, 12,160 ml. এটা Parkland formula use করে করতে হবে. The purpose of maintaining NPO for 6 to 8 hours before surgery is option C, to prevent pulmonary aspiration. 40. In which the following type of fracture the bone is shattered into numerous fragments? Option C, comminuted fracture. Immediate treatment of dog bite. Option C, wash the wound with soap and water. Which of the following is a screening test for balance? এটা already আগে একবার আছে, Romberg test. Silver nitrate dressing may cause depletion of sodium and potassium. Option B. Sign and symptom of digoxin intoxication. Option C, yellow vision. Diabetes insipidus is caused by the deficiency of antidiuretic hormone. According to Piaget, egocentrism is the feature of which of the cognitive development? Concrete operational. Option A. Next, the ability to tolerate frustration is an example of one of the function of ego. Option B. Another term for superego is ideal self. মানে ideal principle এ বিশ্বাসী, তাই এটা ideal self. Specific abilities are measured by aptitude test. Another term for reinforcement is option B, reward. In metabolic process, vitamin D is absorbed in option B, small intestine. To prevent neural tube defect in a baby, which a nutrient is given as the supplementation for the mother during pregnancy? এটা হচ্ছে folic acid. Option C. Which is also known as the accessory dietary factor? এটা আমার হরমোন মনে হচ্ছে, ভিটামিনও হতে পারে. Index of duration of malnutrition. এখানে index of duration বলেছে, এটা মনে হচ্ছে হয় none of the above হবে, না হলে wait for age. এই দুটোর মধ্যে একটা কিছু হতে পারে. এটা তোমরা কেউ জেনে থাকলে কমেন্ট করে জানাও এই দুটোর অ্যান্সার. তারপর 55. The response to iron replacement therapy is indicated by an increase in hemoglobin rate. এটা 55 এরটা হবে 1 gram per week. Option B. The ability of the class of microbes to produce disease is referred at pathogenicity. Cobblic spot on the buccal mucosa is the characteristic feature of option B, measles. IPV is injectable vaccine. এটা হচ্ছে inactivated. Option C. Ophthalmia neonatorum in baby is caused by Neisseria gonorrhoeae. Option A. Type 1 hypersensitivity reaction. এটা option C, IgE. In the natural history of disease, the pathogenesis phase is deemed to start upon এটা হলো first option A, entry of disease agent in the human host. Morbidity in a community can be best estimated by option B, sentinel surveillance. Next, 63. Which is the most peripheral public health center where safe blood services are envisaged under IPH? এটা মনে হচ্ছে CHS হবে, CHC হবে, এটা আমি শিওর নয়. Which of the following scheme provided cash assistance? এটা option C, জননী সুরক্ষা. The emergency contraceptive pills would be used within the maximum period of 72 hours. এটা option C. VIA is a method of screening of cancer of cervix. Option B. তারপরে হুইচ অফ দ্য ফলোইং সেন্টার আর নাও নোন অ্যাজ হেলথ অ্যান্ড ওয়েলনেস সেন্টার, এটা হচ্ছে সাব সেন্টার। আয়ুষ্মান ভারতের আন্ডারে এটা হেলথ অ্যান্ড ওয়েলনেস সেন্টার গুলো করা হয়েছে সাব সেন্টারকে। এন্ডেমিক ডিজিজ মিনস দ্যাট এ ডিজিজ ইজ কনস্ট্যান্টলি প্রেজেন্ট ইন আ গিভেন পপুলেশন, এটা অপশন বি। লাইভ অ্যাটেনুয়েটেড ভ্যাকসিন ওপিভি। Hansen disease is also known as leprosy, option A. As per national immunization schedule, at which age OPV booster to be given, option D, 16 to 24 month of age. A 2 years child having respiratory rate 50 breaths per minute with cough and cold, at which classification of pneumonia, option B, pneumonia. Public harness brace is most commonly used in CHD, congenital dislocation of hip. Vitamin K given to a newborn weighing 900 gram is 0.5 mg, option A. The hormone responsible for milk rejection is option A, oxytocin. Patent ductus arteriosus is abnormal communication between option B, pulmonary artery and aorta. The red color inverted triangle at the center of under 5 logo represent family planning. Flag sign is a sign in which of the following nutritional disorder, এটা হলো Kwashiorkor. Next, FLACC scale is used to assess which of the following parameter in the children. Pain. The portion of vision is focused is on health and nutrition, option A. An example of non-therapeutic communication technique is belting. Patient believe that the nurse and doctor are talking about him. This could be best described as delusion of reference. Nurse can minimize agitation in the disturbed client by limiting unnecessary interaction. In schizophrenia, the term anhedonia refers to an ability to react to enjoyable or pleasurable event, option C. The 3 A's schizophrenia are autism, ambivalence, affective disturbance, associative disturbance, option D. 88. Which of the following is a major side effect of typical antipsychotic? Tardive dyskinesia, এটা EPS এর মধ্যে পড়ছে। Benzodiazepine reduce anxiety by acting on which neurotransmitter? GABA. A mental disorder characterized by stereotype speech, এটা option C, barbigeration. Seminoma testis is a option A, germ cell tumor. Cobweb formation in CSF is characteristically seen in tubercular meningitis, 92 এর option A. 93. Prolonged infection with HPV is linked with মনে হচ্ছে 93 তে carcinoma of the cervix, option B. Which drug does not cross the placenta barrier? এটা option B, heparin. The drug chloroquine on the আমি এটা কোশ্চেনটা বুঝতে পারছি না, যাই হোক। The drug of choice for the ventricular tachycardia is Zylocard, option B. The main adverse effect of salbutamol is 97 এর হবে palpitation and muscle tremor. The commonest cause of fatty liver is option B, alcoholism. Major mechanism of transport of drug across the biological membrane is option A, passive diffusion. Drug of choice of myoclonic seizure is valproate, option C. আজকের ভিডিও এখানেই শেষ করলাম। যদি ভিডিওটা ভালো লেগে থাকে তাহলে অবশ্যই লাইক করো, শেয়ার করো, এবং যদি তোমাদের অন্য কিছু অ্যান্সার মনে হয় বা কোনো কোয়েশ্চেন নিয়ে কনফিউশন থাকে তাহলে অবশ্যই কমেন্টে জানাও।